LASIK surgical procedure we perform on the surface of the cornea. It reshapes the cornea so that you can see well at distance and you don't need contact lenses or glasses. All procedures that are used with lasers to correct the surface of the eye are not the same, and I hope we can talk about that a little bit later. Well, LASIK is performed by eye surgeons, medical doctors who are trained as eye surgeons. There's a lot of confusion about that. Many LASIK centers are owned by either corporations or opticians, sometimes optometrists, and they'll employ a surgeon to come in, oftentimes from out of state, and do the surgery and then go back. That leaves all the follow-up care and the decisions made by non-surgeons. In 1987, I was actually living in New Orleans training to be an eye surgeon. After I finished my residency in New Orleans, I went to the University of Texas Medical Center in Dallas and spent a couple of years there. While I was there, I was trained to do a lot of complicated and delicate corneal surgery that restores vision in people that have damaged corneas. When I joined Montgomery Eye in 1991, we knew the technology was going through the FDA approval process, and in 1995, when it was approved, we decided that we would begin to offer vision correction with lasers. The spring of 1996, we started initially with PRK, and in the fall of 1996, we switched over to LASIK. Since that time, we've performed about 10,000 surgical procedures reshaping the front surface of the eye and corrected the vision for our patients so they don't need to wear their glasses or contact lenses. Well, basically anyone who needs contact lenses or glasses in order to see clearly at distance may be able to have LASIK. What LASIK does is it reshapes the front surface of the cornea, and that changes their natural focus power so that they see clearly at distance. For any one individual to have LASIK, we have to make sure their eye is healthy and appropriate to have a procedure done. Well, the patient experience is really fun, actually. We enjoy doing LASIK, and our patients, I think, enjoy it. We spend a lot of time talking with them about what they'll experience. Basically, the patients are in the laser suite for about 20 minutes. Once we're through with their procedure, they go home and they take a nap for about 3 hours. When they wake up, they already see better and their eyes are generally fairly comfortable. Most patients are able to resume normal activities, including work and pretty much whatever they want to do the following day. Insurance does not generally cover LASIK. At one point it did, but not very often. It is available with flexible spending accounts. It's also available with 24 months interest-free financing for less than $150 a month. Well, the variability in LASIK pricing is due to the fact that there are different ways to perform LASIK. Originally, when we performed LASIK, we used a machine called a microkeratome, and a microkeratome uses a blade to create the flap. And those machines work well, but in 2005, a laser was developed, a different type of laser. We use a laser called a femtosecond laser to make the flap, and an excimer laser to reshape the cornea. The femtosecond laser is a really nice instrument. It has a lot of flexibility. It's very reproducible. In 2005, we decided we would switch to using a laser to generate the flap. In fact, we were the first center in the state of Alabama and one of the first centers in the country to do so. And since 2005, we've virtually done all of our LASIK here using a laser to make the flap. But that costs more than a microkeratome does. The second differentiating factor is that we do custom view LASIK. Many people do custom view LASIK. It costs more to do custom view LASIK. We use a machine called a wavefront scanner to measure the front surface of the eye. It basically gives us what we call a thumbprint of the front of the eye. And it measures the correction differently than just the little machine that says 1 or 2, which is better. That costs more to do also, that we have to actually pay the company more when we do a custom treatment. You'll hear a lot of other terms like luxury LASIK or maybe customized LASIK. Those are not the same things. Those are just terms people use to make you think they're doing what is the best thing, which is a custom treatment. So there is a lot of variability in pricing, but I like to say you get what you pay for. We have to examine the eye thoroughly and completely. As far as corneal examination goes, we measure the cornea in many different ways. We use a machine called a topographer, which makes a map of the front surface of the eye. We do a procedure called tomography, which actually measures the front surface of the eye, the back surface of the eye, the full thickness of the cornea, as well as it gives us the size and complete shape parameters of the cornea, including how it changes the thickness from the center to the periphery, and that's very important in determining if someone can have LASIK safely. As far as the vision correction part of it, we measure the prescription 3 different ways. We check the glasses prescription with the traditional refraction both before you're dilated and after you're dilated, and then we do what we call a wave scan measurement, and we compare all 3 of those measurements and design a treatment plan that's optimized for best vision. Well, we offer complimentary screenings if someone wants to see if they could have this procedure done. Those take about 30 minutes. We don't charge for them. We don't dilate you and do the whole workup then. We do some basic measurements and get a good idea of whether or not you might be able to have the procedure. And if those measurements are good and you want to proceed, then we schedule a full pre-op exam. With the full pre-op exam, we have to dilate your eye, and we don't like to treat people when their eyes are dilated, so we have to wait for that to wear off. The pre-op exam is really extensive. It takes at least 2 hours to do, and it's very thorough, and we cover all the bases to make sure that your eye's healthy and that you can have a successful visual outcome.